Welcome to Roadmap to Residency, Evidence-Based Applications. So in this video, we will be discussing about neurological and psychiatric drugs. We have very detailed videos about these topics in their respective modules. You can go and watch that after the video. So here we have, which of the following is the most appropriate next step in the management of this patient's breakthrough seizures? A 32-year-old woman with a history of epilepsy presents to the neurology clinic for a routine follow-up appointment. She reports experiencing breakthrough seizures despite being compliant with her anti-epileptic medication regimen. She describes the seizures as brief episodes of staring, lip smacking, and occasional jerking movements of the arms. She reports no recent changes in her medication regimen or any identifiable triggers for the seizures. On examination, the patient is alert and oriented with a normal neurological examination. Serum anti-epileptic drug levels are within normal range. Which of the following is the most appropriate next step in the management of these patients' breakthrough seizures? Increasing the dose of the current anti-epileptic medication, adding a second anti-epileptic medication, switching to a different anti-epileptic medication, initiating ketogenic diet therapy, or referral for epilepsy surgery evaluation. So, switching to a different anti-epileptic medication. So, breakthrough seizures, defined as the occurrence of seizures despite adequate anti-epileptic medication therapy, pose a management challenge in patients with epilepsy. In cases of breakthrough seizures, the first step is to evaluate the patients to identify the potential triggers or causes of treatment failure. In this clinical scenario, the patient is compliant with her anti-epileptic medication regimen and the serum drug levels are within the therapeutic range, suggesting adequate drug exposure. Now, despite this, she continues to experience breakthrough seizures, indicating treatment failure with the current medication. The most appropriate next step in the management of this patient's breakthrough seizures is to switch to a different antiepileptic medication. Antiepileptic drugs vary in the mechanism of action, pharmacokinetic properties, and efficacy profiles. Switching to a different AED with different mechanism of action or broader spectrum of activity may help to achieve better seizure control in patients who have failed therapy with one or more AEDs. So which of the following antidepressants is the most appropriate initial treatment for this patient's major depressive disorder? A 45-year-old woman presents to her primary care physician with complaints of persistent low mood, loss of interest in activities she once enjoyed, feelings of worthlessness, and difficulty sleeping for the past several months. She reports a history of similar symptoms occurring intermittently over the past few years, but notes that her current symptoms are more severe and persistent. The patient denies any suicidal ideation or psychotic symptoms. On further questioning, she admits to feeling fatigued and having difficulty concentrating at work. She denies any significant medical history or recent life stressors. So which of the following is the most appropriate initial treatment? Fluoxetine, amitriptyline, phenelzine, venlafaxine, or bupropion? So, major depressive disorder is a common psychiatric condition characterized by persistent low mood, anhedonia, and other symptoms. Selective serotonin reuptake inhibitors (SSRIs) are considered the first-line treatment option for MDD due to their favorable side effect profile and efficacy in treating depressive symptoms. Fluoxetine, which is a member of SSRI class, is very commonly prescribed for the treatment of MDD. It works by selectively inhibiting the reuptake of serotonin at the presynaptic neuronal membrane, leading to increased serotonin levels in the synaptic cleft. This enhances the serotonergic neurotransmission in the brain, which is thought to alleviate the depressive symptoms by modulating the mood, appetite, sleep, and other neurobehavioral function. So, which of the following anxiolytic medication is the most appropriate for the patient's generalized anxiety disorder? 28-year-old woman presents to a psychiatrist with complaints of persistent feelings of anxiety, worry, and restlessness for the past several months. She describes feeling on edge most of the time, with frequent episodes of palpitations, trembling, and sweating, especially in social situations. The patient reports difficulty concentrating at work and avoiding social interactions due to fear of embarrassment or criticism. She denies any significant medical history or recent life stressors. On further questioning, she reports a family history of anxiety disorders. The options are alprazolam, buspirone, diazepam, clonazepam, or lorazepam. So the correct answer is B, buspirone. So buspirone is a second-line anxiolytic medication that is commonly used in the treatment of generalized anxiety disorder. Unlike benzodiazepines, which act on the gamma aminobutyric acid GABA neurotransmission, buspirone has a unique mechanism of involving partial agonism at serotonin receptor, especially the 5-HT1A subtype. Now, by enhancing the serotonergic neurotransmission in the brain, buspirone alleviates the anxiety symptoms without causing sedation, tolerance, or withdrawal effects commonly associated with benzodiazepines. So which of the following is the most appropriate initial treatment for this patient's acute psychotic episode? A 22-year-old man with a history of schizophrenia presents to his psychiatrist with complaints of auditory hallucinations, paranoid delusions, and disorganized thinking. He reports hearing voices telling him that he is being watched and that people are plotting against him. He also expresses fear of being harmed by others and believes that his thoughts are being controlled by external forces. On mental status examination, the patients appear disabled and agitated with disorganized speech and poor eye contact. So the options are risperidone, haloperidol, clozapine, olanzapine, or quetiapine. So risperidone is a second generation antipsychotic medication that is commonly used as first line treatment for schizophrenia, especially in the management of acute psychotic episodes. It acts by antagonizing dopamine receptors and serotonin 5-HT2A receptors in the brain. Thank you for watching. Keep studying hard.